we don't take a lot of time from the speaker because I'm going to speak a little bit about this special lectureship. It is a special occasion that we are commemorating a clinical faculty who served very well here, and this lectureship in his name. Today also is special that the speaker himself is a very dear friend for more than 30 years, and I have been trying for years to get him, and finally I got him. Third, the topic itself is very intriguing. The fire ants, that the bedbugs that are endemic in our area here, and that can cause a big troubles to many people, including fatalities. So I say a word about the person that we are honoring in this lectureship to him. That is Dr. Don Fournier. He unfortunately died at a young age. He graduated from the University of Texas in Galveston, had internal medicine residency and allergy immunology fellowship at Welford Hall, and certified by both internal medicine and allergy immunology. He's a member, a very active member in many societies with the state. Although he's lived in Texas, he's in Louisiana State Allergy Society, always every year used to come, and Texas and the national organizations. He's a member of was a member of the editorial board of Allergy Asthma Proceedings Journal. He was a retired Lieutenant Colonel in the Air Force. In addition to his solo private practice in Texarkana, he actively participated in many scholarly activities. He was a role model of say, clinical academician or academic clinician, whatever applies. For many years, he served on the program planning committees of the Southwest Allergy Forum Eastern Allergy Conference. That's a very popular meeting that's usually done in a nice resort area in Mexico. He was president of the Texas Allergy, Asthma, and Immunology Society. He was a governor of the regional and state and local allergy, asthma, and immunology in our southern region. For us here, he was a volunteer clinical faculty to the program. He came regularly 3 days a month. He closes his private solo practice to come to the allergy immunology clinic here for more than 20 years. He was a very good teacher, and all the fellows who were exposed to him appreciated him. Therefore, some of the fellows, with the help of other friends, initiated the lectureship, the annual memorial lectureship in his honor. Our speaker today is Dr. Richard deShazo, that I was preparing to speak to him about for 1 hour or 2, but I thought since the time is limited, I will just 5 minutes. He graduated from the University of Alabama. He's a real Alabamian, can I say that? Internship in Pediatrics at the University of Alabama Hospital in Birmingham. And he is at heart is a pediatrician. But while he was in Pediatrics, he was given the option. Would you like to go to Vietnam, or you go to be trained in internal medicine at Walter Reed? So he made a decision and went to Walter Reed, where he got the residency in internal medicine, against his will apparently, and he got a couple of fellowships in microbiology, immunology, and clinical immunology. He's diplomat of the internal medicine and allergy immunology, rheumatology, geriatrics, and I don't know what else is going to take more. That's enough. He's a fellow or a member, very active in the national organizations, whether the Academy or the College of Allergy Immunology, and numerous other organizations, not just a membership, but very active contributing person. He served on the board of directors of the American Board of Medical Specialties, the American Board of Internal Medicine, the American Board of Allergy Immunology, and the Association of Professors of Medicine. He was the president of the Southern Society of Clinical Investigations, editorial boards of many journals, chaired several influential committees at universities, the NIH, and national societies, many national honors and awards, and he made more than 300 publications on various areas of allergy immunology, including chicken nuggets. His study on chicken nuggets made me hate this food that I liked very much. Because what he discovered that Mississippi researcher finds little chicken at all in nuggets. This is a cartilage, this is a gastrointestinal tissue which disgusted me. Right? There is all kinds of random stuff in there that's not chicken meat. And now you're depriving me of one of my favorite little things. Historically, he started serving in the medical corps as assistant professor in the Uniformed Services University of Health Sciences, as the director of the lab of experimental immunology and allergy clinical immunology at Walter Reed, visiting scientists in the National Institutes of Allergy and Infectious Diseases. His honorable discharge from the medical corps as lieutenant colonel, just like our honoree as well, with commendation for meritorious service. After the medical corps, he went to a university in somewhere in Louisiana called Tulane University as associate professor, where at that time I was at LSU New Orleans, and that's when our friendship started. We were probably the only services that were friendly to each other between the two schools in New Orleans, together also with the pediatric pulmonary that I was a faculty on at Tulane. So it was a wonderful example to show that. He's a co-director of allergy immunology section at Tulane, director of research and clinical operations, and he was a special consultant to me. At that time in the 80s, some of you are not born yet, there was a disease, and still up to now, chronic urticaria patients is a pain. So when they are displeased with me, I say there is an excellent professor at Tulane. He is highly specialized in this disease. He will cure you. So I will send them there and I'll be happy. Then I discovered that he is doing the same to me. And I send him, and they send me back other patients in that. From Tulane, actually, we were supposed to leave New Orleans to work together in some place, but he was smart and pulled out, and I was stuck with that job by myself somewhere. He moved to Alabama, and he took one of my fellows when I left New Orleans. Before him, he took care of two fellows that I left behind. Very kind of him. They were very good, two fellows, were fantastic. He took one of them with him to Alabama when he went as the chairman of the Department of Medicine and director of the training program in internal medicine and the chief of the allergy immunology and vice president of Health Services Foundation. This is just some of his activities at the University of Alabama. And he didn't learn his lesson to be a chairman, and he went to another place to be a chairman again. I don't know how he got the guts to do it again. I admire him. No, before Gloria. What's happening with this now? He moved from Alabama to the University of Mississippi since '97. Again, went to as a chairman of the Department of Medicine until recently. He left it, but he stayed there as the professor and also as a distinguished professor, consultant to the Vice Chancellor, the Board of Directors of Mississippi Physician, Mississippi Arthritis Foundation. He's a much, much more. Again, I don't have the time to talk a lot about him, but he's a great person, a family man. This is when he was, what are you at, 18, Rick, at that age, with his beautiful wife, Gloria, and one of their 3 children. He has 6 grandchildren, and he is involved in many things, wide areas of research, community activities, national activities, and I envy you, Rick, and I thank you for coming. It is a great joy having you. We welcome you. Please welcome with me Dr. deShazo.
You want to get me up there? You want to get mine up for me? Get my...
Well, I have a plaque for you, and I left it in the office there.
I'll get that later. Just get my talk up.
Oh, you're going to talk?
Oh, yeah.
All right.
Well, good morning, everyone. It's a pleasure to be here, and I've been looking forward to coming up for some time, and glad that our schedules finally coincided. The purpose of this talk is to show you how much fun academic medicine can be. And for some of you who are still looking for career choices, thank you, Sammy, to try to encourage you to consider academics. This is a life choice that gives you a lot of pleasure, because when you're my age, it's not how much money you've made that gives value to your life, but how many people you helped along the way. That's what really is the reward, at least for me, and I think probably for most people who go into medicine, that is most important. So our family went to, is this thing supposed to go forward when I do that? Is that what it's supposed
to be if you direct it there, I think.
Oh, okay, good.
No, then how do you do it with the mouse? Yeah.
Okay.
No, but it's supposed to appear also on the other screen.
Yeah. Why don't you sit there and do my slides where I can talk to them?
Well, I would be honored.
No, he's going to do it for me. I got one of my former residents to take care of this for me. Will you advance the slides for me?
Yeah.
Okay, so what happened to our family is after a number of years in the Army, where I was training to be a cellular immunologist, and working primarily in immune deficiency diseases, this thing happened, and New Orleans was the site of this thing. And what this thing was an epidemic of infections and death in gay men. So the National Institutes of Health decided that they wanted to establish several AIDS clinical trial centers, didn't call them that at first, research centers, to try to figure out what was going on, because large numbers of people were popping up with this disease where they had lymphadenopathy. They got these terrible infections and died. And so I left the military because the military had decided that they were not going to do research in this area, and that's what I wanted to do. So went to New Orleans, and the first thing that happened on the next slide is when we were moving into our house in a wonderful area called Kenner, our oldest daughter, the one you saw in the picture, who's very inquisitive, found this thing in our front yard, that thing, and immediately went over there and started playing in it. I didn't know what it was while the moving van was moving the stuff in, and it was basically eaten alive by fire ants. Now, I didn't know what a fire ant was. Was not interested in fire ants, and that doesn't have anything to do with cellular immunity, I thought. So But because I was a little angry that this had happened, I began to learn a little bit about these insects and what interesting things they were. And I learned, first of all, that what I was doing, because I tried to stomp these things out with various and sundry techniques, is that one of the reasons that it was so difficult, is it working now?
The pointer.
Oh, okay. One of the things, okay. One of the things that was most interesting is the part of the fire ant mound that I was dealing with was the smallest part, and that there were tunnels going all these different directions, and no matter what you did, you couldn't get rid of these unless you knew what you were doing, and I didn't know that. Next slide. So while we were working on the AIDS Clinical Trial Center, I started doing a literature search, and my mentor at Tulane told me that the best way to find out something is to do a literature search and find out who the best people in the world doing the work is and cold call them. So I did that. So I started cold calling various folks, entomologists, people in South America, and trying to learn about these ants. And it was very easy to get these ants because we had levees all over New Orleans, and they were all over the levees, and so I would go out and stick my hand in there and let them crawl around and notice that there were all different sizes of them, and that they immediately would start doing this copulatory movement on your skin, and I got stung enough to know that there were two hits. That first you got to pinch and then you got to sting. So we began to look at that literature and found out, of course, that most of the fire ants that we deal with as walking around folks are females. There are winged males, and I begin to find these winged males in the spring because I'm a swimmer, and the swimming pool that I swam in at a center was outside. And so in the spring, I would go swimming, and the pool would be full of termites, just all dead termites. Well, those weren't termites. Those were male fire ants that had attempted to mate with the sole winged female, that big one over there, who jumps up out of the fire ant mound for some reason where eggs have developed and a queen has grown, and goes up in the air and meets with these jillions of males triggered by some unknown stimuli, and becomes fertilized and then goes off to start a new mound. So that was interesting too. And here is one of these ants that I got with one of our local photographers in the medical school, and you'll see that they look sort of like crawfish on the front end. They have mandibles that are very, very powerful. So what they do is they first attach with the mandible, and in this copulatory movement, they then insert their stinger and sting an average of 3 times per contact. I did some more work and identified the leading entomologist in the country who was in Florida, who was working on fire ants for the Department of Agriculture, and realized, it's interesting, as an Alabama native, that these things had come into Mobile primarily from Uruguay and Paraguay in the 1940s through the Port of Mobile in banana boats and other things, and had basically spread all over the Gulf South. And in the process of doing that, there was an evolutionary experiment that took place in which they had evolved or adapted. If you're a Baptist, they adapted. If you're a Methodist like I am, they evolved. So they continued to move. And this is the present FDA map of where these things will probably end up. And this is, unless there's some further evolutionary adaptation, and we'll talk a little bit about that going forward. So this is going to be a really big problem. Fortunately, I took fire ant queens up to Bethesda for many years, trying to get them to take root at the NIH because I couldn't get funding to study them. Got lots of AIDS funding, but no fire ant funding. And we finally got funding, but they're going up there soon. Next slide. So what happened is that these ants brought into Mobile, which has, if you know anything about azaleas or camellias, it's one of the richest areas to grow azaleas and camellias, and those had been transported all over the southeast in nursery stock and up the east coast and so forth. And the ants had made, queens had burrowed into some of these pots sitting outside while they were growing, and you basically had these everywhere. So that was the mode of transmission. Moreover, they had hybridized with a very docile black and red species fire ant, and those ants were more cold tolerant than they were. So that allowed them to become more cold tolerant. Plus they use the federal highway system. If you've noticed that there are ant mounds all over on either side of the highway, they use the asphalt as heat sumps, which has allowed them to go further north and hide when it gets cold under the road system and survive. Another thing that they have done that is fascinating is when we went to New Orleans, there was one fire ant mound here, and a half a block later there was another one, and you had to go look for them. Well, now if you notice, there are two of them together, and what has happened is that for some reason or other, the queens stopped killing off other potential queens, and now fire ant mound, rather than having one queen laying 500,000 eggs, can have 20 queens. So, and they're living together very closely. So that's one of the reasons that the number of encounters with these has gone up to almost 100% in areas that are affected, and we have a very dense colony of these. If you want to see something really funny that's Louisiana specific, that maybe isn't so funny depending on whether or not you're a fan of reptiles, there's a Great Dirty Jobs episode that I had plugged in here but I didn't have time to show you, where they're focusing on the fact that the alligator populations in South Louisiana are being decimated by these ants because they're getting in the eggs before they hatch and eating up the embryos. So we haven't noticed it our way. We've still got so many alligators we don't know what to do with them, but we'll see how that works out. Certainly they have decimated most of the ground egg-laying bird populations in South Alabama and South Louisiana. And the farmers have a lot of trouble with these because not only do these mounds tear up their tractors, if they have calving and the calves are laid on the ground, they eat them alive. They go in and sting them and eat them. So they are more than just a pest. They are a real problem medically and economically. So about this time, our oldest daughter came home with this note from school, and it said, your daughter is gifted and talented. Well, I knew that. All of our kids are gifted and talented. And because she is gifted and talented, she has been put in a science class and she has to do a science project. And my response was, oh shit. I don't have time to fool with this. I've got this AIDS thing going on, and now, whoa, I'm interested in fire ants. She could do that one. So this was before the time of the real IRB function, and you could basically do whatever you wanted to do, and that's mostly what I did, whatever I wanted to do. So my wife was president of the Civic Association in this little neighborhood we lived in close to the levee in New Orleans. And so at one of the meetings, I had our daughter stand up and say that she was doing a research project on fire ants, and anybody that was stung by fire ants to please sign up. And of course the entire neighborhood signed up. And so she divided those individuals up into groups on the basis of what kind of reaction they had. Fortunately, nobody had had anaphylaxis, but they had these cutaneous reactions, and when we looked those up in the literature, there basically was nothing there about it. So this is the reaction everyone gets, which is a wheel and flare reaction, because these, these venoms that they have and the alkaloids have vasoactive components in them that cause mast cell release in the skin. This doesn't mean that you're allergic, it just means that your mast cells are being degranulated by these components. And then a certain and everyone that got these things, especially in July, when there was a lot of venom in the ants, would get these sterile pustules. And the people that got the sterile pustules for the first time had all been seen in the emergency room at the local hospital and put on antibiotics, or thought that they might have chicken pox, or referred to an infectious disease person. All kinds of misadventures and mistreatments took place when this is the usual and customary response, a sterile pustule at 24 hours. Then a small percentage had had these kinds of reactions, these indurated, intensely pyretic reactions at the site of the sting that came up in 12 to 24 hours. And it was interesting to me because I had done a project when I was a fellow at Walter Reed looking at late cutaneous reactions to allergy shots. We had biopsied these, and I had worked with a pathologist on this, and I said, that looks interesting. So the kids got together and identified 19 people who were willing to come down to our lab, and I stung these people in our lab with live fire ants, and we measured the reactions over a period of time, and this is what we got. We found that most people got the wheel and flare reaction. This was a self-selected study of people who were having trouble, so we were loaded with those, and that was good. And they had reactions that just kept going. And at that point, I went back to the rule that I had learned earlier, which was find the best person in the country. So I found the best dermatopathologist in the country, who happened to be the chief of pathology at Harvard Medical School, and called him up and cold called him and told him about these reactions, and told him I was from New Orleans and that if he would help me, I would invite him down for a drink, and he signed on. So Hal Dvorak, next slide, helped us look at these, and fortunately for me, the worst reactor we had, this one, was my wife. And so you see her 3 stings, the average number of stings you get from an ant, and this huge late cutaneous allergic reaction. And we biopsied the heck out of this. We biopsied it at 1 hour, 2 hours, 3 hours, 4 hours, up to 48 hours. And I happen to be a reactor too, so we biopsied me, and I've got an arm full of scars to show it. And what we came up with was that there are, this is the timing. We talked about the usual and the allergic reactions, a uniphasic reaction, a biphasic reaction. And this is the pathology that Hal Dvorak came up with, which is amazing, and we don't have time to talk about it, but make a long story short, these are fibrin deposits in the gel, and these are big swollen lumps. And this was the first time that we were able to show in vivo that the IgE-related inflammatory response could activate the coagulation system. This has some importance in another area, but we could actually anticoagulate these people and sting them, and they would no longer get the late reaction. So this caught on in the literature, and I started getting asked, I was turning out large numbers of paper on HIV, which I was very proud of, but nobody would ever ask me to talk about it. Sammy would never call me to talk about what was going on, but they're all interested in the fire ant stuff that I was doing on weekends and at night. So we continued to do this, and the big problem is we didn't have any venom. We were grinding up these ants. We'd go out on the levees and get a garbage can, fill it up half with water, get shovels and dump these ants into these garbage cans, and they floated up to the top, and we would get the ants floating out, and we'd grind them up and extract them, and that's how we were getting venom, which was sort of a tough way to do it, plus it was pretty dirty stuff. And so we learned how to milk these ants under a microscope and get drops of venom to work with, and worked with others to find out what the venom was. And of all surprises, this was a big one. Only 5% of the venom was actually protein. Most venoms are all protein, but these were very unique ants and insects in that they had these organic alkaloids in there that had been described, but nobody knew what they'd done. They'd been synthesized, but nobody knew what their role was. It was a laboratory phenomena. And so we began to work with folks who were interested in sequencing protein, and others had sequenced these proteins, and we now know that there are at least 4 different proteins in the venom component, and those are called solanopsins. It's interesting that solanopsin 1 is a phospholipase A that is used to digest prey, and it is also present in some of the vespid, the wasp venoms. And that may be why so many people who are wasp allergic also have skin tests to fire ant venom that are positive, even though they don't have fire ant reactions. There's this cross-reactivity. So that was an important thing to know. This also began to help us figure out whether or not venom would be the right way to desensitize people. And to make a long story short, the fire ant whole body extract, which we are using, actually has enough intact protein in it and is a lot cheaper to make than milking fire ants or synthesizing them, that it is the only insect allergy that we can treat with whole body extract, ground up insect with extracted, because of the particular unique features of these proteins. It's just as effective as the venom if you got venom in there. Some of the extracts don't have any. So we worked with some chemists, tried to figure out more about the alkaloids, and we did some fire ant studies using the whole body extract versus venom for diagnosis and treatment, published those. And then about that time we decided we got a call from our home state, and they had started a new medical school in Mobile. The chairman of that department was a mentor of mine at UAB, and he asked me if I was interested in coming back to Alabama to help grow this school. So it's all like Shreveport. It was a regional medical school at the time, had not grown to the size of this one and wanted to grow. So we went back to Alabama to try to help with that. And we continued to work in this particular area because fire ants obviously were a big problem there. And one of the first things I noticed when we got back to Mobile is by this time we had computer-based searches, and it was very easy to look at the literature. I noticed that 2 hospitals in Mobile had been invaded by fire ants, and people had been stung and injured in these hospitals. And on further analysis, I realized that both of these hospitals were ours. We had 3 hospitals, and 2 of them had fire ant infestations, and at night these ants were coming out and foraging for food, usually in times of drought when there was a shortage of water and other food, they were making their mounds in the walls of these buildings. Again, another effort to stay warm during the winter, and then coming out and rambling around and getting on people's beds. And then these disabled people, many of them with Alzheimer's and other problems, would flip around. It would trigger the ants to sting, and when they sting, they release pheromones, and they call in more ants, and they'll be covered with ants stinging them, and some of them would get huge venom doses, and so that was sort of interesting. Next slide. So we began to study this particular area. I pretty much had to do it because I was an officer in our health foundation for the university, and we were sure we were going to get sued because of this, and so we had to do some due diligence to sort of sort through this. And as a result of that, again, to make a long story short, another part of this strange journey of someone working as an academic physician, things that happened on nights and weekends while you did the rest of the things you were supposed to do. We developed, along with a entomologist, Jerome Goddard, who happened to be the state entomologist in Mississippi and had trained done part of his training in Mobile. we did a Google on him. It wasn't Google at that time. We did a search on him and found him, and he had a big interest and experience in attempts to avoid envenomation by snakes and other things. And so we worked out these protocols for nursing homes and hospitals, not only how to prevent them from getting infested, but how to deal with an infestation and how to deal with a patient who was found by a nurse's aide in the middle of the night covered with ants. So what do you do? And by the time the legal suits started coming in, we had this all published, and I was an expert because I was the only person that had ever written about this, and so all these plaintiffs' firms kept coming to me to wanting me to be an expert. So by this time, our oldest kid was in college, and she got, it's the gifted and talented one, she got a scholarship, academic scholarship, but it did not cover the rest of her expenses. So my consulting with these plaintiffs' defense firms against the plaintiffs' lawyers, the largest firm of which was in Mobile, paid her expenses at college. You know, we're poor and we have to work extra. So about this time, I got a call from the University of Mississippi. Similar thing, they wanted to expand their programs. They had a big building program, and I had been in Mobile for 9 years and worn out my welcome there, and it was probably time to leave. So I took this job in Jackson and found it to be a wonderful place, and identified not only Dr. Goddard, but another entomologist. By this time, the original entomologist I had been working with had retired, Dr. Williams, who had replaced Dr. Banks, the individual I was working with at the Department of Agriculture. And I also found out that they were experimenting with some very interesting techniques to try to get rid of this fire-ant infestation, and a number of those studies were being done in South Mississippi. So here's a list of some of the ones they did, but the most interesting one to me was one I actually used on one of our deans. This is a what's called a florid fly that was found as the only natural predator to fire ants in South America. And what this fly does, and the videos are amazing, it basically, the fire ants are in their little area, and the thing sort of circles like, you know, one of these military surveillance things, and then comes down and hits these ants in the head and deposits eggs in their head. And then their heads fall off. So that's why I thought this would be especially good for our dean. We were never able to scale it up large enough to work on him, but we at least thought about it. And so the FDA is continuing to work with releasing these florid flies and seeing what it does to these fire ant colonies, since the baits that we use, you have to bait fire ants. You have to, because the queen never eats food that isn't digested, and you can't get rid of the mound until you kill the queen. Right now, Amdro and these other things that we use in our backyards are baits that are slow-acting toxins that are taken down into the mound by the worker ants, chewed up, fed to the queen, and then 4, 5, 6 days later, the queen dies. And in the interim, you're wondering why the stuff didn't work. Well, it takes a while to work. And many people don't like that. So this is, and it's not possible to take hundreds of square miles and put Amdro all over them. So they're still working in this area, and we've been continuing to talk to them about that. We also were able to get with a biochemist. Many of these people who were in nursing homes that were being stung went into heart failure immediately. And some of them did not have a reason to be in heart failure. So we actually looked with our physiology group as to the effect of these on contractility. And actually these solenopsins have negative inotropic effects, and that probably explains some of the toxicity that we're seeing. We also work with our infectious disease people, because I figured there was probably a patent somewhere in here. The fact that these ants sting people all the time, and these really never get infected. We had aspirated the fluid out of these things and studied them, cultured them. There were no organisms in there. In fact, it appeared that there was some antibacterial activity. And so we worked with our other colleagues at Ole Miss and looked at this, and in fact, several of these solenopsins have antibacterial activity and are being looked at for possible topical use and so forth. Of course, they're pro-inflammatory, so whether that works or not, I don't know. But it was another part of this story that was sort of interesting. So that's pretty much where we are with our fire ant work. We pretty much, on the side while doing other things, had a lot of fun with the kids, going to meetings in plush resorts, getting money from plaintiffs' attorneys for college tuition, and then doing what we're supposed to be doing, just on a project because we had our eyes open and were willing to work with people. And that's something you can't do in practice. The resources and the collaborations that I had and the friendships that I made with all of these people along the way, people like Sammy, who is a dear friend, would have been impossible. And so we've learned all this stuff about them, and we could talk about that forever. Basically, the fire ant stings are common. Everyone has itching in a hive at the sting site if there's enough venom in the ant. Some people have local reactions. A few have anaphylaxis. Other reactions are rare, but they do occur. Some people develop a serum sickness-like illness. The fire ant immunotherapy works. The problem's not going away, and we're continuing to dabble in that area, but it's not an area of as big an interest because Jerome Goddard, that entomologist, called me up, and he said, do you know anything about bed bugs? I said, no, and I don't want to know anything about bed bugs. He said, well, you're a medical entomologist, aren't you? And I said, what is that? He said, that's a doctor that is interested in insects. And I said, well, I'm running a department over here and hiring people and growing programs, and yeah, but you're still a medical entomologist. I said, okay, I'm a medical entomologist. What do you want? He said, well, come over here and let's talk. And what he told me was that the health department where he worked was getting calls from all these hotels and motels, not all of them, a lot of these hotels and motels, especially those that were close to the new Nissan plant that had just opened. They had a lot of international travelers coming in. We have a huge Nissan plant that runs, looks like it's for miles. And they have all these other companies around them that make whatever they make, seats and floor tiles or whatever they put in cars. And so there are people coming in and out of the airport all the time trying to sell stuff and buy stuff, and people coming from Japan, and people who you know, are international business people and come from Europe to Jackson, Mississippi, which is not exactly Europe, and all kinds of things travel, and they were bringing in these bed bugs. So the health department was trying to figure out what to do about this, and we discovered, of course, that this was a national problem. It wasn't a local problem, and that we weren't even in the top 15. In fact, during this time, Grand Central Station in New York had been closed because it had a bed bug infestation and in some of the seating in there, and they were afraid the entire city of New York was going to be bed bug infested. So at that point it was time to learn a little bit about bed bugs, and fortunately Jerome Goddard was an expert already and taught me about bed bugs and the fact that they lay eggs, and the eggs are viable for long periods of time. They tend to, and they are human parasites. That's our primary host. That one acquires the bugs by contact with another person or a substance like clothing that is infested, that they feed at night, and that they feed on blood. And that was sort of interesting because I'd been interested in HIV. Well, do these things transmit HIV? That's sort of interesting. Well, or other things. And here we got all these HIV. We have a large HIV population in Mississippi that are getting bed bug bitten. Is that going to be transmission and so forth and so on? So this got to be very interesting very quickly. And we again went to the literature and found out there was nothing in there on the medical side. A lot of entomological stuff, but very little medicine stuff. So we did a huge literature search, got on the phone, called other people up, and ended up writing what ended up being the state-of-the-art article on fire ants that was published in JAMA in 2009. And again, we noticed that there were different reactions to these bites, and they had never been characterized. So we've looked at the bites, the allergic reactions to them, the psychological reactions, which ended up being very interested in disease transmission. And the usual way, much like the fire ant, they usually bite more than once. And I don't know why they do that, but, and they call this, the entomologists call this the breakfast, lunch, and dinner distribution, where at night when you're asleep, they come out of your mattress and bite you, and you may have, with a low concentration of these, you may have a few and may have others. We found a little bit of stuff in the literature about the fact that there were late in time reactions like we'd seen with fire ants. And so obviously what we did, because Jerome worked for the Department of Health and was the chair of the IRB, he got a bunch of bed bugs and started letting them feed on himself, because that's the way that entomologists keep bed bug colonies. They don't want to have them random. They get them from somebody else that they know is HIV negative, hepatitis, and they get these colonies and they grow them in their lab and they bring them out and feed on them, and you can watch them, and then you put them back in a bottle or wherever they are, and then they keep them alive. So we started letting Jerome get reactions and other people at the health department, and begin to identify patients that were coming to the health department with reactions, and we were able to identify the cutaneous reactions that people were getting to bed bugs. So most people who were bitten by bed bugs got nothing. They didn't even get those little places that I showed you. Some people got itching, some people got edema, some people got these erythematous reactions, some got the papillary urticarial reaction, generalized very much like you see in children. So fairly, papillary urticaria is a condition that for some reason or other occurs predominantly in children. And then there are people who got these bullous reactions. And that was really interesting to me, the bullous reaction. So here's the usual erythema, here's the papillary urticaria type reaction, and here are the bullous reactions. So those were really interesting. Nobody had ever described those. And because of the connections I had with these pathologists in Boston, I said, well, maybe that's sort of interesting. So we began to classify these, and in particular we're interested in the blisters-bullous reactions, which actually look a lot like a TB reaction, and that's what I thought they would be. People who are hyper immunized to TB, who have had TB, you know, if you put a TB skin test on them, they rot their skin off. It gets these big bulla and blisters, and if you don't put steroids on there, they can just slough off part of their arm. That's one of the reasons that you try not to skin test people that have had TB. And about the same time, another entomologist who was a bedbug entomologist from Florida called us up and said, I got a problem. I've become allergic to my bedbug colony and it's screwing up my grant. Can you help me? And I said, absolutely. So he flew into Jackson with a whole colony of bedbugs, and we put him up at the at a motel very much like the one you put me up in, across the street from the medical center with this colony of bedbugs. And he went over there and let them feed on him in the motel. And I went over and biopsied his skin every few hours. And this is what it looked like. It's pretty awful. You can see, you know, we actually biopsied him all the way. I taught him how to biopsy himself, and he biopsied himself when he went back to Florida. So we were able to get a whole series of biopsies of these. And to make a very long story short, this reaction that he was having looks very much like Churg-Strauss vasculitis, which is a Wegener's variant. And it's a hybrid vasculitis in which there is evidence of an immune complex component and a cellular component and an allergic component. And we're still sort of sorting through this. There's granuloma in there. There's a lot of edema. There are a lot of eosinophils. And this was the first time this had ever been demonstrated, this particular reaction had ever been demonstrated to an insect or to anything else outside of Churg-Strauss vasculitis. So there you go, another serendipitous find by working with Dr. Mims, who succeeded Dr. Dvorak at Harvard, and he helped us put all that together. Let's go to the next slide. So, do they cause anaphylaxis? Probably not. There's only one case in the literature. Are they responsible for, are they vectors? Can bedbugs be vectors? Well, we thought no. We reviewed all the literature on all these areas, and we thought that hepatitis B was the only one that was likely, and that it was unlikely until about 4 weeks ago when the NIH sponsored grant at Penn looked at transmission of Chagas disease, which is transmitted by triatome, that particular variety of insects of which the bedbugs are in that general family, and they say that it can now be transmitted. So this whole area has suddenly gotten interesting again, and I'm getting plaintiffs' lawyers calling me up again, wanting me to be an expert. Well, the kids are all through college now, and the answer is get lost. You know, I don't want to do that anymore. And but we'll see what happens. Next slide. We thought that since most of the people that had bed bugs went crazy, I mean, you wanted to blow up their house, or you know, or wanted to blame it on somebody else. And I had seen a concert organist who came into town for an organ concert, came into our clinic as an emergency with this rash all over and missed the diagnosis, which was very embarrassing, subsequent to which he figured it out and came back and went crazy. We thought that PTSD might be a common effect of being infested in your home or your place of business or yourself having bed bugs, and we looked at this. Basically on the net there are sites where people with bed bug bites report you know, it's a chat site. So we went through and used the criteria, and unfortunately we're only able to clearly establish PSD in one of the 145 patients, but we were able to get it published, so there you go. It is interesting, and it probably is not an uncommon consequence. So the only thing I have to tell you is, before you go into your local hotel, you can do like I did when I came into our local hotel. Now this was a very, very upscale place. The medical centers stand up and sleep. What was that name of it?
Sleep in, stand up.
Sleep in, stand up over here. So what I did is I put my bag outside of my room. I did not take it in the room. I went in the room and I pulled back the mattress cover and I looked around the rim of the mattress, and I did not see any of that, because more often than not in an infested room, that's where they hang out, in the mattress or around the mattress. And this stuff is feces. Basically, after they have a blood meal, they eat, and you can see them. They're not that difficult to see. You can actually see them running around in there if you look for them, because they're big enough for you to see. They look like micro roaches. And I want to thank Sammy for inviting me, and all these folks who have been collaborators. Most of those articles have medical students or residents or fellows as first authors, and all of us in Mississippi, this is across the street from my house. These are Pelicans who have evacuated from Louisiana and come to a more friendly place in Mississippi. Wish you a happy holiday. Thank you.
We may have a time for one or two brief questions. Can you tell me how we confirm bedbug reactions?
Yeah, it's very difficult. It's a combination of the typical physical finding and establishing the presence of bed bugs in the environment. So you pretty much have to establish that they're being exposed. And if they're coming back from a trip, it can be very hard to do that. If you suspect it and you tell the person that you think they have a bed bug infestation, they will usually go bonkers. So we are very, very careful about doing this, but what we usually do is have them bring in, have them check in the house around the mattress looking for these, and if it's not there, they usually don't have a problem. But they can bring this. We've had several homes in the Jackson area that have been infested after people come back from Europe. Some of the best hotels in Paris, since you go to Paris frequently, every other week to have cocktails, have been infested with these things.
By the way, you complained about the hotel yesterday. I changed it for you. After dinner, I put you in a better hotel.
Yes, you did.
And you could not enter. This
No,
is real.
that's
This
right.
too. You did not
Sammy
enter.
managed to drop me off at the wrong hotel after dinner last night.
A better hotel.
I walked into the better hotel, and the lady said, "Who are you?" And I said, "I'm the LSU guest, and we don't have any of those." But we
We married. Dr. Manchel.
One quick question on the Billy the Exterminator show and other places you see where people have bed bug infestations in their house, they'll close it all up and superheat it to try to kill the bed bugs. Does that work?
Yeah, the problem is that the bed bugs are resistant to all the usual and customary perethrins and other things because they've been used so long, and so it's very difficult to kill them. And superheating them is one way to do it. It's very expensive, very expensive. To me, it makes a lot more sense just to clean out the house, but unfortunately, if you leave a single egg, those are around for years and they can hatch for some reason later. So that seems to work, but right now most of the pest services are having people move out and using very toxic pesticides and cleaning out the reservoirs of them.
And have you seen any evidence of decreased property values for people who have bed bugs?
Oh, the psychological, that's my next thing, is to write a New Yorker article about
That'd be as bad as a house
psychological
somebody
stuff.
killed
You don't tell
bed
any
bugs.
neighbor you got bed bugs.
Yeah.
Yeah, right.
Oh yeah, I saw a lot of pictures of fire antibodies, and I was wondering, some of them had a lot of body surface area covered. I was wondering, did y'all come up with any treatment or any change, like a body surface area percent-wise, which led to different interventions in practice?
We actually have looked at that. We haven't published it, but we have looked at it pretty carefully in the clinic. And for people who have the allergic type, the late cutaneous allergic reaction, if you put them on a high-potency topical steroid immediately after getting the sting, it usually knocks it down fairly quickly. We have them use a fluorinated steroid about every hour for about 12 hours. That usually gets rid of it. We have some people like my wife who actually can get a compartment syndrome, and those people take steroids every time that they're stung. And because we've had people that have to have fasciotomies for this. So it's important to have them, the ones that have big reactions, to elevate their extremity if that's a problem. That will get rid of it most of the time. And of course, if you put them on allergy shots, the allergy shots do work on the late reactions. They do turn those off. But that's not usually an indication for allergy shots. The risk-benefit is in favor of trying to treat them locally. But I put several people who have had compartment syndromes on shots, and it gets rid of it.
I remember when I was in New Orleans, two particular patients. One of them, an adult, he was cutting the grass and fell. His brother was listening, and he found him late coming. When the aunt found him,
we have a jogging
Anaphylaxis.
We have a jogging track. We have a jogging track around our development, and everybody the jogger goes out about 5 o'clock in the morning before the sun comes up and runs. And last year we had an attorney found dead on the jogging track. He was a guy who was known to have had anaphylaxis, went to an emergency room, was sent out without an EpiPen, and about 3 months later, never got to an allergist. About 3 months later, got stung while he was running dead. 3 kids, no dad.
Unfortunately, some of our patients here are refusing immunotherapy, which is very good method of building immunity. Now, the toxic reaction goes, I remember a baby came to Charity Hospital there, that the baby was put on the floor, and the ant skin caused toxic reaction, and that baby from toxic reaction died. It was not allergic, but many were ant skin.
Thank you very much.